Hello, my name is Catherine Milne. I am from Connecticut Clinical Nursing Associates located in Bristol, Connecticut. Today we are going to discuss case studies in urinary and fecal incontinence. Our objectives today are to discuss pathophysiological changes related to aging as contributing causes of fecal or urinary incontinence and describe nursing interventions for these disorders. Additionally, we will look at a stepwise approach in managing urinary and fecal incontinence. I think we've all seen the psychological impact in terms of social withdrawal and depression in our patients, but we have to ask our patients questions about how they compensate. For example, are they planning all their shopping trips around where there is an accessible bathroom? The physical consequences will compound the psychosocial component and make depression worse. For example, if you have altered sexual function. And we're all aware of the physical things that we see in our day-to-day practice: increased falls, pressure ulcers, and incontinence-associated dermatitis. In terms of data looking at the scope of urinary and fecal incontinence, we have to give our hats off to Donna Bliss, who's been a nurse researcher in this area, as well as Joan Junkin and Joan Selikoff, who have looked at acute care in addition to the across the continuum work of Dr. Bliss. The scope obviously is tremendous. Most patients over the age of 80 and who are community dwelling have urinary and fecal incontinence. It is also very prevalent in both skilled nursing facilities and acute care. We know that these numbers are probably low because urinary incontinence is underreported. Urinary incontinence adds $10 billion a year to the U.S. healthcare system. And if you have a chronic disease such as dementia and HIV, which are expensive to care for to begin with, it adds an additional, for example, $15 billion a year to caring for the dementia patient. And for employers, it costs a lot of man-hour because it will take up to 2 hours a day per person to take care of somebody who is incontinent. As we age, our urinary tract changes. For example, we have a decreased ability to concentrate urine and resorb that water, which means 20 to 30% more volume goes to the bladder. And now that we have reduced bladder wall contractility and our bladder volume decreases, it means we need to urinate more. Additionally, we have reduced antidiuretic